How do we treat lower face aging, the lower face and the jowls? Well, to start to understand the options that we have in clinic to treat this area, we have to understand why we're aging and how we're aging in the first place. And we are aging on many different layers in our face, sadly. Our skin is aging, it's losing collagen and elastin, and its integrity is getting worse as we age. But actually, there are changes happening throughout our face and our skull, and even the bones of our face are changing. So our mandible, our jaw is softening, and it's become less of an acute angle as we age, and our chin gets less protruded. So we have less structural basis for everything that's on top of our face to be supported. The volume in our face is also changing. So fat pads in our temples and our lateral cheeks and mid-face are getting smaller, and the fat pads in our jowling areas are getting bigger. So we're getting heavier here, we're getting lighter here and losing volume here. Our jaw and our chin is moving inwards and coming together, and that is creating this jowling effect here. And we treat that through several different options. So to start with, we might treat it with energy-based devices. So if you have skin laxity, if your skin is starting to lose collagen and elastin, and that's your main concern, we might start talking about a bit of radio frequency microneedling. So that is microneedling creating micro traumas to stimulate the skin to heal itself better by putting collagen and elastin down and really targeting that skin health. But also the radio frequency heats the ends of those needles, and by heating the end of the needles we can actually help reduce some of the volume in the jowls and in the double chin. If you do have a little bit more volume under the chin there, it's a really effective treatment. The other energy device that we have in clinic that's good for lower face is the HIFU, the high intensity focused ultrasound. It's unique because it has absolutely no downtime, but what that does, it uses ultrasound waves in a very focused manner to really target the top layer of the skin, but also deeper structures too, in the SMAS. It can help really tighten that lower face, help reduce the volume in the double chin and the jowl area, and stimulate collagen and elastin. We then move on to restoring some of the volume that's maybe been lost by bony reabsorption, and that might be an option of dermal filler. Here in clinic, we always do it under ultrasound guided imaging to make sure it's really safe. But what we can do is the idea of putting it behind the gonal angle here, so the angle of the jaw. If we put a little bit of filler there, that we can help recreate the bone that's been lost and help support the lower face. Sometimes also a very well put filler in the chin and in the gap between the chin and the front of that jowling area can create an illusion of a straighter jawline, and that in itself can really help hide those jowls and support the lower face. We've also got anti-wrinkle injections, and they can be incredibly effective at giving us back a youthful appearing jawline. This works by relaxing muscle, and we relax in this case a muscle called the platysmal muscle. That's a sheet of muscle along the neck. If we relax it here, if you think of the sheet of muscle being tight and straight, if we relax it back, it's going to push it back in, and it's going to help the appearance of that sharper, more snatched jawline. The other thing we've also recently brought into clinic, and I'm really excited to discuss, is the biostimulator Sculptra. So Sculptra has been around for quite a few years, but it's a powerful biostimulator. It's not a filler as such, but what it does is it stimulates collagen and elastin, and sometimes it's called the shrink wrapping effect of the face. It can really beautifully restore volume loss in the temples and the lateral cheeks and stimulate collagen and elastin, tighten that skin up. And it's one of the few things in clinic that can really give a lift to the face. By giving a lift, it can help that lower face and around the mouth as well. And it's wonderful for skin health. So that's another option that we've got offered in clinic. Always best to come and have a consultation, come and have a chat with us, and we can talk you through the options of what's best for you, and we can answer any questions that you may have.